ولا إله إلا الله سبحان الله والحمد لله ولا إله إلا الله سبحان الله والحمد لله ولا إله إلا الله.
With you 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum. This is your very own Dr. Shabina Asad Qayyum for Salam Radio 106.2 FM. And what a delight it's been to come back and speak to all of you wonderful people on the show. And that is why I always start off with saying or greeting all my listeners in the Islamic way, which is Assalamu alaikum. And do you know what that means? For those of you who are not of the Islamic faith, because this show is about building bridges, it means peace be upon you. And I'm ever so proud to say those words. So yes, to those of you who are joining, peace be upon you in whatever language you speak, whatever background you're from. You are always welcome here on the wonderful platform of Salam Radio to listen to, I always say, your very own Dr. Shabina Asad Qayyum. And I mean it. I mean it from the heart. It's been a very tiring day today. Mondays always are very tiring, aren't they? I work as a GP at Bretton Park Healthcare. I love working there. I love the team that's there, and I love my patients. I love the work that I do over there. I really do. I enjoy what I do as a GP despite all the challenges, and so do my colleagues as well. So it's great to be here. How has your day been? The reason why I ask that is because I'm going to be talking about a very pertinent topic that can also be work related as well. So before I come on to that, it would be great to see how your day has been, and just to share with me a little about how do you get over, or do you indeed suffer from something that they call Monday blues. Tell me, I'd like to hear. And the only way that you can get in touch with me is to call us on 01733 602 133. Or you can text us on 07411 191062. Additionally, you can comment on the live stream on Facebook, YouTube, X, which was the previous Twitter, or Twitch. I tend to use Twitter quite a lot now, or X quite a lot now, apologies. And it's great, the platform that you can sort of tweet out little thoughts during the day. And I do a lot of reflecting. It's part of who I am, part of my individual personality makeup, I'd like to say. And one of the things that came across to me in the chaos of the world right now, we know that the world is very chaotic at this moment in time, is that people, individuals, and we're all different, remember, and I'm going to share this with you because I feel I have to. People always have a choice in life, don't they? All of us have a choice. All of us either has a choice to choose between good and bad. We have a choice to hate or to love, okay? And the thing is that to hate won't make you remembered. But to love, you will always have people on your side. So I choose love over hate every single time, because it just doesn't matter. Even if there's one person out there that is in need of your love, is in need of your compassion, that one person is worth it. So I'm going to leave you with that because it's important to me. And it is important to spill out as much love as possible in today's climate because of everything that goes on around us, isn't it? Number one, the weather as well. Come on. For goodness sake, warm up, March. We've had enough of this cold weather. And to put up with this icy cold, I was so disappointed when I opened the window this morning and I saw that Jack Frost had been out overnight and sprinkled all the grass and the trees with white, crispy frost. It shouldn't be. We need to warm up now. The daffodils have come out. Mother's Day is around the corner. So, of course, we do need a bit of perking up, don't we? But without further ado, I'm going to talk a little bit about something that I believe is pertinent to each and every one of us. And when I was little, I used to hear people who were older than me always say that they were suffering from a headache. And I used to think, oh, I wonder what it would be like to suffer from a headache. And now I've grown up. Well, I think I have anyway. Well, some people might disagree, but I've grown up. And I have a family of my own, which is a beautiful, beautiful family. Couldn't have been more grateful. But I suffer from headaches on and off, of course. I often am able to get over them. But if there's anything that I don't think that I've covered well enough on my shows, it's a very, very common ailment of headache. And I was speaking to Brother Akil Khalil of the Tech Show. I hope I've got that right. He's an amazing brother, by the way. And we were talking about headaches. And, he gave me the idea to do this show. So I was thinking, I need to do this show for him. So he's got the first shout out. Brother Akil, if you're listening, you have the first shout out. And the second shout out is to a Mr. Adil Karim, because he put up something really witty underneath one of my posts this morning. It was after, it was just before I was going to do my clinic, but I've just seen and spoken to so many patients that it was wonderful. It was witty the way he came out about it. And I'm so grateful for all of you that really give me so much encouragement. You really are all so wonderfully worth it. It's unbelievable. So yeah, thank you so much for all of you to join in. But yes, that was the thing. So Adil Karim had basically said that he was suffering from awful headaches, and he gave a very simple trick, and that was he upped his water content. So yes, dehydration, absolutely right, can be a cause for headache. So try to address that. And without further ado, let's talk a little bit about it. So what are headaches? They're very common, obviously, aren't they? And many people like to treat headaches with simple painkillers, drinking extra water, simply by waiting for the headache to go away. But there are times when these headaches can affect one's quality of life. And it's one of the most common reasons for attending a doctor's surgery or a neurology clinic. Will you believe it? In fact, so much so that neurologists locally in Peterborough, at least, get back to us and give us a standardized sort of treatment pathway on how to treat people who have headaches with no unknown cause if we've investigated them in terms of medication. So we usually embark upon that pathway. But it's very interesting, isn't it? How it's the most common ailment amongst people when they go and present to their GP or to a neurologist as well. So what is a headache, you may ask? It's pain or throbbing in the head, in the face, and I also include in that in the neck as well, because everything from the top of your head, the top of your scalp, up until where the neck meets the chest or the torso is a headache, okay, is your head area. So anything that happens here can be considered to be a headache. Most headaches are not caused by sinister conditions. Many people, when they present to me with a headache that they've tried to address with medication, very often say to me that they're worried about having a brain tumour. Often, very often, that is not the case, but it's important to take a thorough history and an examination of anybody who does have a headache as well. So if symptoms of a headache are different, people understandably do worry about that, don't they? Even if it's something that's quite severe, out of proportion to what you would expect. There's a certain amount of pain that everybody has when they have a headache. And when it's out of proportion to what you can bear, then yes, it is natural for a patient to worry about that. And hello, well, I have Mr. David Garner, the wonderful Mr. David Garner. Thank you so much, David, for joining and tuning in. Honestly, I really do wait for your wonderful little witty comments. So I'm going to read out David's joke of the week. And David Garner is a regular listener for Salam Radio. Thank you so much, David, for listening to my show, and indeed a regular listener of the Body, Health and Mind show. So he usually lightens the mood by writing a joke. And you make my day, David. Thank you so much. You are wonderful. So I'm going to share David's joke, and that is, I just got back from the hospital after eating a can of cat food. Don't ask meow. You always, you always make me laugh, David. Thank you so much for that. That was a wonderful, wonderful joke on David's behalf. Thank you for perking up our Monday as well for all of our listeners. That was David Garner's joke of the week, folks. So wonderful. Thank you very much. Now, coming back to headache, we were talking about headaches. And by the way, a headache is never normal. So if you say, oh, I've got a normal headache, a headache can never be normal. Anything that makes you feel that you have pain or makes you feel unwell or out of sync is never normal. So just keep that in mind. Now, I'm going to be discussing generally about various forms of headache, the most common types of headache, and how you can treat them as well. And where to consider if a headache can be signs of a more serious illness. That's very important. Now, we always have a classification for illnesses, most illnesses, and there are two types of headache. They can be primary headache or they can be secondary headache. Now, primary headache are when there is a cause that is related or in proximity to the head. And secondary headaches are when they are a side effect, say, of a medication or a separate illness or an injury. So those are known as secondary headaches. But very, very occasionally, headaches may need further investigation to rule out more serious underlying causes. So I want you to think about that for a little while. Primary headaches are those headaches that are caused as a result of conditions that are to do with the head, predominantly head, neck, and face. And secondary headaches may be due to a side effect of something or maybe even referred pain from somewhere else. And the most common types of headache are tension headaches and migraines from a very long way off. So tension headaches and migraine headaches really do top the ratings for being the most common type of headaches. And what are tension headaches, you may ask? Now, tension headaches aren't just because of stress. Stress is a cause for tension headaches, but tension headaches are also the most common type of headache and are usually felt as a band or pressure across the forehead, and they can last for several days. They can be very uncomfortable and tiring, but they do not usually disturb sleep. So that's one thing to think about. They don't usually disturb sleep and they can be very uncomfortable. And I'm also going to talk about a headache that affects our youngsters. I'm seeing a lot more people who are within the younger age bracket that suffer from headaches that's known as tech head or tech neck or tech headache, which is as a result of looking at technology like your phone, your laptop, your iPad. And there's a reason for that, and I will share that with you. Now, people who have a tension headache can carry on working. It's uncomfortable, but these type of headaches worsen as the day progresses, and they're not usually made worse by physical activity, although it's not unusual when you have a tension headache to be sensitive to light and noise. And what I usually say to people are that if you're somebody who has a desk or office job, make sure that first of all your posture is correct, because there is quite a common tendency for people who suffer from tension headache to relax their shoulders. And when you relax your shoulders, you will see that the top of your shoulders have a tendency to roll sort of forwards. And that is not a good position to have, because your spinal cord connects with your head. It has a shared blood supply. And as a result of that, you can, by virtue of your posture, impede or restrict that blood supply to a very small degree. But that can then lead to developing headaches. And the other thing I'd like to say is that you have a very complex, tightly wound network of muscles that go across your back, into your neck, and bind your head together. And what happens is that when you are in a posture, or you're sat at the front of a desk, or you're watching a monitor, depending upon what position you are, if your position or your posture is not upright or the way it should be, your muscles can go into spasm, and that can also lead to a headache as well. So please be wary of your posture. Your feet should ideally be flat on the ground when you are sitting on any chair, with the desk in such a way that you're not slouching too forward, or that it's at an adequate height, that if you need to type or you need to write, that you aren't slanting forward to do so. And the same is with a monitor or a computer, that it has to be at eye level so that you're not excessively bending your neck downwards or even upwards to have a look at the screen. And make sure that you get screen-free time. And these are factors to help mitigate a tension headache. And I thought it's better because what I usually do in my shows is I usually give you what different types of disease there are, and then at the end I'll tell you about the treatment. But I think that it's quite nice that whilst I am talking about different types of headache, I can obviously speak to you about the treatments as well. So these are more making sure that you get up away from screen time and that you're walking around, or you go out for some fresh air, even if that's for 10 minutes. And always make sure that you are well hydrated when you're sat at an office-based desk, if that is the nature of your work. And as a GP, I predominantly sit in front of a desk. Obviously, there is a little bit of movement and mobility when you see patients face to face, but it is largely in front of a desk. And I'm very careful that my posture is okay, because I have, on occasion, come home feeling that my neck's very tight, and I do have tension type headaches. So that's something I'd like to share with you. I also think that when you come home and you have this type of headache, the first line medication to take would be paracetamol. So that's very important as well. So I have a Mr. Manik Kulkarni Karpate. I hope I've pronounced that correct. Thank you so much for joining. And Mr. Manik Kulkarni Karpate says, "Hi Shabina, good point on forward head posture that leads to an occipital headache." Thank you so much. Yes, because you can get occipital headache. Occipital basically means the back of the neck and the scalp region. So that is what we mean by occipital headache. So thank you so much. It's good. Oh, sorry, Mrs. Do excuse me. Yes, it's lovely. It's lovely that you could come on board. And thank you very much for listening to Salam Radio and the Body, Health and Mind Show. It's a pleasure to have you on board. Thank you. So go home and make sure that you're well hydrated, have a nice shower, relax those muscles, come out of the shower, wear your comfiest clothing, and then sit down and honestly, mark my words, have some screen-free time. It's easier said than done, but how many of us come from work and then start to get on our phones? I know I'm guilty of it. I put my hand up, but it's very important that you have screen-free time. Relax, do some mindfulness, and if your headache still doesn't go away, take some paracetamol, and make sure you've eaten as well, because often not eating throughout the day can also give you headaches too. So that is what I'd like to share with you regarding tension headaches. Now, coming to the one that I think is sat at the top of headaches. A lot of people say, oh, well, I've got this headache and my GP always says that I've got a migraine, and we see it dotted all over medical notes. Migraine, 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 migraine. What exactly is a migraine? They're a very, very common type of headache, sitting up there alongside tension headaches as well. And a typical migraine is actually one-sided, and it can be throbbing in nature, where you feel a pulsing coming out of either one, or even sometimes, in very rare occasions, both temples. And it can also be located behind one eye. So headaches that are more one-sided, that cause throbbing pain, and in some instances can also make you feel nauseous, are more likely to be migraine-related headaches than tension headaches. So that's just the differentiation. So can you see the trend? You've got a front band type of a pain, sometimes covering the whole head with a tension headache, and with a migraine, it's usually one-sided. Now, if you've just joined Salam Radio, welcome to the show. It's wonderful to have you all on board. I've got my friend here, Lee Taylor. Good evening, Lee. It's wonderful to have you. I'm so glad that you could make it. And again, I'd love for you to participate on this show alongside all the others that are listening. And I've got my wonderful friend Stacey Cook. Hello, Stacey. It's wonderful that Stacey could join as well. And Stacey has asked me a question that I will answer. So Stacey has asked, what treatment would you recommend for ocular migraines? Now, that is a very good question, Stacey, and I'm going to come exactly to that now. So I've described, obviously, what migraines are, and cluster headaches as well are very severe headaches, sort of akin to migraines, but their cause is completely different. But I am going to talk to you a little bit about migraine treatment because that's very important. And sometimes these ocular headaches or ocular migraines ocular migraines are basically those migraines that are centered around one eye. And sometimes they can be so disabling that some patients actually need to go to bed to sleep off that headache in a dark room. And they can often, very often, cause extreme sensitivity to light and sound. So what do you do about them? Now, the cause for a migraine is a small vessel in the side of the head that pulsates. Okay, it pulsates, it becomes dilated. Dilate means widening. And as a result of that, you can feel the pain. Now, there are medications like Migraleave, for example, that are used to constrict or narrow that vessel that is pulsating with a view to reduce the intensity of the pain. Sometimes that doesn't work. And these medications are known as triptans. You've probably heard of sumatriptan, zolmitriptan, and they can sometimes come in intranasal form where you insert them into the nose. And that, Stacey, is a good treatment as well. So zolmitriptan you can get in form of a nasal spray that you can use to instill within the nose because the absorption is much more rapid and gives you quicker relief of a migraine than oral medication. That's one option. The other option that a lot of people speak about are daith piercing. Now, the daith is the soft part of the ear that closes your ear hole, okay? And a lot of people have said they've sworn by it. And the theory behind it, although there's no substantive studies to recommend it, however, the theory behind it is that there is a nerve that is shared because we have a mesh of nerves, and I'm trying to keep this as simple as I possibly can, that can be associated with causing the pain of migraine headaches. And the aim would be to somehow nip that in the bud because you've got a very intricate mesh of nerves and blood vessels going throughout your head and neck. So the evidence base is not very strong behind it, but it is very, very important that we acknowledge the fact that yes, sometimes you can use daith piercing to help cure migraines, and there is some evidence to suggest that having Botox as well can help with migraines. There are some people that have Botox in the jaw to help with a condition called bruxism, which is grinding of the teeth, and that can help migraines as well. And Manik has just asked me, would you please guide on giant cell arthritis and common signs for a layman to identify an action plan for the same? That is wonderful. I will definitely touch on that after the break. I've got Sana Kauser. Assalamu alaikum, Sana. It's lovely to have you on board. I saw your comments earlier today. Would supplements such as magnesium and zinc help with headaches? So supplements such as magnesium and zinc. It's always good to have a supplement in which you're deficient in. So if most certainly you are deficient in magnesium, as some people can be, it's helpful to have that. Magnesium is a wonderful, wonderful supplement. It's shown to help in conditions that are related to tiredness, fatigue, bowel problems. And we know that there is a link between people who have migraine headaches, irritable bowel syndrome, and depression because of the hormone serotonin. And magnesium can help calm some of those digestive effects as well. So I would say test for your magnesium first. And absolutely, there is some merit to say, although that again, the evidence base behind it is poor, that yes, magnesium and zinc as supplements can help with migraine headaches in particular. So we now have around 40 seconds to a break. What I think we have 10 seconds to a break. So when you come back, we will continue on this subject of headaches. Don't forget to stay tuned.
Stay tuned to Salam Radio after this short ad break.
Satisfy your cravings at Ibrahimi Buffet Restaurant. Enjoy a tantalising variety of Chinese, Italian, Pakistani and comfort food favourites, from starters to desserts. Kids under 5 dine for free, so bring the whole family to our restaurant at 63 Sycamore Avenue. Open every day from 5pm to 10:30pm. Call us on 01733 313131 or book online to reserve your table. Ibrahimi-restaurant.co.uk. Every bite is a delight at Ibrahimi Buffet Restaurant.
Masterminds Tuition Academy is for your high schoolers, your something to provers, your subject strugglers and keen learners, your brave jumpers and fist pumpers. Affordable personalised learning plans are delivered through our centres in schools across Peterborough. But not to worry, we also provide online and home visits with flexible timings. Whether it is maths, English, science or 11+, Masterminds is a must. Find us on all socials and visit our website mastermindstuitionacademy.com or call us on 07516 166 003. Masterminds, master the matrix.
Where can you get high quality and low prices? Amar Food Store and Halal Meat in Lincoln Road, Triangle is the place to go. Pay us a visit and take advantage of our special offers and great range of products on groceries, vegetables, fruits and halal meat. Also send money to Pakistan absolutely free. We have all top brands at special offers, offer free customer parking and provide a free local delivery service. Amar Food Store and Halal Meat, 613B Lincoln Road, Peterborough. Call us on 01733 687 374. High in quality, low in prices.
Thinking of laser hair removal but worried about cost? Well Skin Clinic, Peterborough's #1 aesthetic clinic, offers 0% finance on courses of laser hair removal. We perform thousands of treatments using the Soprano titanium in our prestigious clinic. Virtually pain-free and suitable for all skin types, our team of aesthetic professionals can help you achieve your goals affordably. Well Skin Clinic, making life-changing aesthetic treatments affordable for all. 40 Cowgate, Peterborough. Call or WhatsApp us on 01733 555540.
At Master's Pharmacy, we put your health and convenience first. We offer free blood pressure checks and blister-packed medication. With our free same-day prescription delivery service, you can have your medication when you need it. We also offer travel vaccinations, including Hajj and Umrah, along with other services to meet all your pharmacy needs. For more information, contact Master's Pharmacy on 01733 567 208 or visit us at 303 Lincoln Road, PE1 2PH.
2020 World Buffet is inspired by the best foods from around the world. See our teppanyaki chefs grill your food to order, or choose delicious Indian, Italian, Chinese, Mexican dishes and British favourites, all halal. 2020 World Buffet offers you unlimited food at a set price. Open 7 days for lunch and dinner. Catering, wedding and party services available too. Call 01733 566 320 or visit 2020buffet.co.uk. 2020 World Buffet, 35 New Road, Peterborough, PE1 1FJ.
Assalamu alaikum. Greetings, shalom, salam, welcome back. Everything is wonderful to have you all back and to have you speak about this headache topic. And I've just had some great interactions. So some great questions. And Sana, I'm going to come back to your question, and then Manik, I'm going to come back to your query as well. So would supplements such as magnesium and zinc help with headaches? Now, the evidence base behind it isn't very strong, but there have been a few minor studies that have done so. And the studies that have demonstrated using magnesium and zinc are good for preventing headaches, migraine headaches, in small studies. However, if you fall into that group of people that doesn't like to take medication for whatever reason, if you have a migraine type of headache, and remember, migraine type of headache is different to a tension headache and other headaches, as I've explained earlier in the show, then magnesium and zinc, there is some evidence that coenzyme Q10, vitamin D and vitamin B2 are very, very good for preventing this kind of headache as well. And we've already spoken about Botox. Some small trials have been done for Botox as being good. And daith piercing. I would not have the courage to have my daith pierced, I must say. I just, I look at it, and those that have are very brave, but I can't do it. So I'm not going to. But again, one of the things that I think is really significant here is to point out that migraines can most often come on in women of reproductive age that are about to come on their period and have migraine headaches just before they are about to come on their period. It's worse at that time as well, and in the first couple of days of their period. And they can sometimes, these migraine headaches can be preceded by something called an aura, which are flashing lights or effects or just blurred vision in some cases. So if you have migraine headaches just before you come on your period, you cannot take a certain type of oral contraceptive pill. So just be wary of that too. Also, please never forget that whatever headache you have, you must never compromise on your intake of water, taking as plenty of fresh air as you possibly can. So some nice walks, deep breaths, fill your lungs with oxygen, because the deeper breaths and fresher air you breathe in, it's good for your heart, good for your circulation. You get that great blood supply reaching the brain. And that is where you are then able to achieve all that you need to help treat this headache. So that's what I'm going to say about migraine headaches. Now, I am going to touch a little bit on giant cell arteritis, which is temporal arteritis. And temporal arteritis is a type of headache that people present to us, which can be the cause of eyesight loss. That is why it is so important. And it either occurs on one side. Again, it's a one-sided headache, has to be differentiated from migraine. And the difference is that people can feel tender on the side of their temple whilst they're combing their hair. That's one of the signs. If you comb your hair and it feels very tender, that can be a sign of temporal arteritis. Also, it's a pulsating type of headache, and it encircles one of your eyes as well, and your eye can be watery and your vision can be blurred. Now, if you have visual blurring in any one of your eyes alongside temporal sort of or a pulsating in your temple, and tenderness when you're combing your hair, that your scalp feels very tender, it is very important that you get to speak to a health professional as soon as possible, because you need to be put on steroids as soon as possible to prevent eyesight loss. That is the danger of temporal arteritis. So those are the hallmark signs of a temporal arteritis, that your temple feels tender, especially when brushing your hair, the side of your head feels tender, and also visual blurring on the same side as the headache. So that is the difference between temporal arteritis and a migraine as well. So the cure for that is not just going to sleep, but picking up the phone and speaking to a GP or a health professional, NHS 111, as a matter of urgency, because that is very, very important too. Now I'm going to go on to another type of headache now, which are known as cluster headaches. Cluster headaches are very severe, and I can tell you, I have in my professional lifetime seen an individual with a cluster headache, and that patient screamed, literally screamed. I did a home visit on the individual, and their spouse felt completely helpless. I had to give an injection of pain relief to help that individual. They screamed, and I will never forget the sounds of those screams. And that's how severe cluster headache can be, because it is an intense, severe headache. And the person that I saw screaming said one word to me, that the pain is so severe that I feel like committing suicide. And that is why these headaches are called suicide headaches. That's why they're so severe. And they occur in clusters. They often last for a number of days and can even extend on to lasting for weeks. And then they disappear for months on end. They are very uncommon, and they particularly occur in adult male smokers. So be aware of that. The connection with being male and smoking doesn't bode well with you if you have cluster headaches, because you need to stop smoking. Okay. Now, they're very, very disabling. You cannot do anything when you have a cluster headache. Let's be quite honest. You can't work. You cannot get up. You cannot talk. You cannot move your head. It literally comes in a wave and you scream. It's very bad. It's very distressing to see. And actually, clinicians feel quite helpless when they see somebody who's got a cluster headache as well. They have a very watery eye on the same side, and sometimes, in some cases, a stuffy, runny nose. And it's important to acknowledge the fact that these headaches can be so severe that their treatment is equally as important as well. So, let's not forget that when you have a severe headache, or we're talking about headaches, emphasizing on the treatment is very important too. And the medication that I spoke about just before the break, known as triptans, they're the first line of medication that is given for cluster headaches as well. And it can be given by injection, or it can be given by intranasal, which is through the nose type of medication as well. And the good thing about these injections, the sumatriptan or the triptans, are they can work within 5 minutes. They're very quick when you do give them. And the doses are, for an adult dose, it's around 6 milligrams. And you can give this medication within a gap of about 2 hours if the initial injection doesn't work. And side effects sometimes do occur, such as nausea, sickness, but at least you don't have that horrible, horrible headache. And yes, the other side effect is that this medication puts you to sleep. So if you are working with machinery and you don't want to sleep, or you're driving and you have a job that is driving, yes, that will put you at risk. So make sure that you are aware of the side effects of this medication as well. A really interesting treatment for these headaches are 100% oxygen therapy. Yep, believe it or not, it definitely is 100% oxygen therapy. And this is an alternative treatment that can sometimes be advised, especially if those injections, those triptan injections, those intranasal treatments aren't working. But it doesn't work in everyone. That's the thing with oxygen. It doesn't work in everyone, and it has to be delivered from a special mask that is attached to an oxygen cylinder. So that's just one thing to take in consideration as well. And those people that suffer from regular cluster headaches need to have that oxygen canister at home as well, which obviously you've got to be aware with oxygen. It can be flammable and it has to be stored correctly as well. So also to keep in mind that if you do have cluster headaches, having 100% oxygen might not be a suitable treatment if you have underlying conditions like COPD, which is chronic obstructive pulmonary disease. So that's something that you have to be aware of too as well. I always like talking about prevention. Treatment is important, but prevention, my goodness, has its place. And what a wonderful world it would be if we knew the prevention of all illnesses on planet Earth. We don't, but I think we can get there. And I often say, and I often think that we don't emphasize enough on prevention. And I've always said that age-old adage that prevention is better than cure. Of course it is. And I think that personally, I think that the NHS needs to look at investing more into prevention, not less into cure, but actually more into prevention. Preventing illnesses like cancer, for example, inflammatory bowel disease. And that really all ties up, doesn't it, with our commercial produce of food, how we eat, how our habits are formed, how we advertise in this country. I think there's so much that we can do in the way of prevention that's a really long and a very interesting conversation to have. So prevention, I feel, is always better than cure. So if you don't have an illness and you start undertaking measures to prevent it, what a wonderful, wonderful outcome it is that you don't get a particular illness because you've been working hard at it and preventing. And again, I'm going to draw your attention back to the main parameters of ensuring that you have a good sleep, and this is in reference to headaches, that you have a good sleep, that you have enough fluid intake, and that you're also stress-free, that your posture is correct, and that you're getting plenty of exercise, and that you're not on your technology for more than what you need to be, which is something that I need to work on. But these are 6 parameters, and any of us can achieve those 6 parameters. Just imagine if you're getting the right amount of fluid, which is essential for your digestive system and to bathe your organs in fluid. It's important not to be dehydrated. It's important that you have the right amount of exercise and you're eating a healthy diet as well. It's important that you get the right amount of sleep or the right hours of sleep. It's important that your posture is correct. So these are just small things. And yes, apart from the vices of making sure that, yes, you are cutting down on your fat and salt and not smoking, these are a given. But actually there are things in our control that we can do that we don't have to spend any money on and any time on, that are within our control. Remember, at the beginning of this show, I spoke in a completely different context when I said people have choices, and therefore we all have a choice. We have a choice to be able to drink enough water. We have a choice to be able to have adequate amount of sleep. Sometimes we don't have a choice when it comes to sleep, because some of those who have small children or have underlying pain conditions that hamper their sleep or hinder their sleep, or physical conditions that hinder your sleep, might just be an exception to that. But we definitely have a choice with being able to have enough water in our system and actually seek medical advice. We're so fortunate with the NHS. But then I'll go off on a completely different tangent. So I do want to have to finish off this topic about talking on headaches. Now, we've spoken in quite a bit of depth about tension headaches, migraine headaches, their treatments, cluster headaches. Again, it's treatment. And I'm going to come on to chronic tension headache. So chronic tension headache is caused by muscle tension at the back of the neck, and it affects often it affects, would you believe, women more than men. Now, I wonder why. So, chronic basically means that it is going on for longer than it should be. They can be started by neck strain, sitting awkwardly at a computer for hours a day, like I do as well. But for that, you've got to keep your posture straight. And tiredness, and it can be made worse by medication overuse, which obviously can speak about. Now, medication overuse is something that I'm very conscious about when I treat my patients with headache, because I like to have a history. I like to hear about what they're doing. Why is it during the day they get this increasing headache? Why is it they're coming to me? And any person that presents to me and says they have a headache, first things first, you have to take a thorough history. Often I find out that, yes, they do a desk-based job. I call them in, examine them and say, do you know what? Actually, your posture is absolutely miserable. I ask for honesty on behalf of my patients and do ask them if they are using their technology more than is necessary. And I'm telling you, I see this in so many teenagers, this chronic tension headache. And if they say no to me, I just do an examination of, I'm going to go back. If they say no, that they aren't using technology, then I go and do an examination of their neck muscles and this wide muscle known as the trapezius, which is the triangular muscle that comes all the way from the neck to the tip of the shoulder. And if I see that they're tense, then yeah, they have been using their device, or they have been sitting in a way or looking at a screen or doing some type of activity that has made their shoulders seize up. So it's really important to reflect on that. And those of you that are listening to this show tonight who have teenagers with you or young adults with you or children especially, if you have a headache and you are also spending lots of hours studying, this can cause your muscles to seize up and give you chronic tension headaches. So please be very wary of that too. I have a question, and it is the lovely Kiran Ayub. Assalamu alaikum, Kiran. Thank you very much for your question. And the question is, Salam, what shall I do if I have bad headaches or migraines when I'm fasting during Ramadan, please? This is such an important question. Thank you so much, Kiran. This is a wonderful question. And whilst you're fasting, Ramadan and fasting headaches are very common. Now, Kiran, the reason why a lot of people have headaches during Ramadan when they are fasting is because they are dehydrated. If you remember, during the beginning of the show and along the course of the show, I have said that if you are dehydrated, that can be the cause of headache. Invariably, there are a few factors why people can get headaches when they are fasting. First of all, yes, an obvious lack of water makes them have headaches. 2, the fact that your sleep pattern becomes disturbed because you are waking up at the crack of dawn to have the morning meal and close your fast, and then all the way throughout, if you have to go to work like you do in the UK, then you don't have the option of going back to sleep. And I fall in that category. So I suffer from severe headaches, and I'm very, very, well, I won't say I'm moangy, I'm not. But that can also cause headaches too. And what can happen is that throughout the course of the day, these headaches can become worse. They only become better when you replenish your body with water. So that's the cure, okay? And often what I've also said is that when you have a headache during Ramadan, there is a really good exercise that you can do. And that is the 4-7-8 method of breathing. So you take a deep breath in and count to 4. You hold it and continue to count to 7. And then you release it on a very long 8. Okay? And that can help with headache during Ramadan. Sana, I'm loving your questions. I'm so happy that you have joined. So thank you so much. So, Sana, is stress and overthinking a major factor of headaches? Of course it is. It most certainly can be, especially at a time when young people are giving and studying for their GCSE exams and also for their A-level exams as well. So stress most certainly is a major factor to cause headaches, and overthinking most certainly. Nobody should overthink. Don't ever overthink anyway, because tomorrow is never promised. And by you thinking now about what's going to happen in the future isn't going to change the outcome of what's happening in the future or what's going to happen. So quit overstressing or overthinking about what's in the future. And actually, what's happened in the past, you've left behind. So there is only one way, and that is forward. Okay, so I hope that's answered your question. Ali Iftikhar, Assalamu alaikum. It is lovely to have you on board. Salam, what is the best way to overcome depression and anxiety? Well, I really like your question, Ali. And I promise you what I'm going to do for you is in my next show, let's talk about depression and anxiety. I do a lot of mental health shows. There are some shows that I've done in the past. But yes, it's a very big topic. And I think that there is a lot of room for it. So if you allow me, I will most certainly, for you, air a show on depression and anxiety and what to do for it, as opposed to talking about what it means. Okay. And Kiran Ayub says, thank you. Well, no, thank you. Thank you for engaging in this show, because it's so important. We have 10 minutes left, and I do want to talk a little bit about medication overuse headaches. Now, medication overuse headaches can be the bane of any clinician's life, because what medication overuse headaches are, it's an unpleasant headache. It really is. It's a long-lasting headache, and it's a rebound headache, and it's caused by taking painkiller medication for a headache. So it's literally, you found yourself in a bit of a vicious circle, aren't you? If you've got a headache and then you take medication and you find that, oh, well, this isn't going away, it's still there. It's actually because you've overused the medication for a very long time. And I've got Lee again with a wonderful comment. Would be good to talk about chronic pain also, please. Definitely keep these suggestions coming. This is what makes this show. I want to talk about things that affect you. I definitely will, Lee. I'll put that on my list as well. And Sana, thank you, Auntie. You're a huge inspiration to many people, including me. Well, you're an inspiration to me, because I'm here to support the young ones here in the city. And Sana, I am so heartwarmed that you've come and you've made such a wonderful contribution to this show. So thank you so much. You're an absolute superstar. So I dedicate this show to you. How about that this week? So thank you so much. Now, coming back to medication overuse headaches. So when you take painkillers regularly, do you know those patients that usually will pop a pill of paracetamol whenever they have a headache and it doesn't work, and then they take ibuprofen and then the headache doesn't go away, and then they think, oh, well, let's just take this regularly, shall we? Your headaches or your condition or your body develops something which is known as tolerance to this medication. And what happens is it makes more pain sensors in the nerve cells in the head. That's what happens. And that is why your pain remains. Eventually, there are so many pain sensors in the head that it's extremely sensitive, and the headache then doesn't go away. It's a horrible, horrible condition to have. But what happens is a person who's suffering from medication overuse headache doesn't quite understand that, and they take more medication and the headache just doesn't go away. So they are the most common cause of secondary headache, and they can be treated, but they require stopping of the painkillers, which can be very difficult in the short term as well. So I think it's really important that it's about sort of going what we call a bit cold turkey when you stop medications for headache. And I think that it's important that you think about that if you are somebody who is suffering from medication overuse headache. I have to also say that, I mean, it's the last 3 minutes of the show. There are so many headaches that one can talk about, but you have sinus headache as well, which is as a result of sinusitis. And sinus headaches are characterized by forward forward bending and feeling that pressure in the head and in the face where the sinuses are. And that's often cleared by steam inhalation, using saline nasal washes, and on some occasion a steroid nasal spray, which can actually be bought over the counter. But those are also reasons for having headaches, and sinus headaches can sometimes be confused with tension headaches. So make sure you know your headache. If I move on quickly, the sinister signs of headache as well. So there are lots of other headaches, but the sinister signs of headaches are that you can have bleeding on the brain, which is a hemorrhage as well. It's a very serious condition. Your vision can go, first of all. It sometimes is initiated with what you call a thunderclap, which is you feel an explosion in the head and you don't have time. Some people fall unconscious, they have slurring of speech, they have paralysis on one side of the body, and their vision goes on one or both sides. So that is what the headaches are. They can become progressively worse as well. And then you've got the headaches as a result of meningitis. If you've got fever, neck stiffness, you can't touch your chin on your chest, and you are sensitive to the light, that may be a sign that you have meningitis, especially if you have a fever. Please seek advice from your GP. And then brain tumours. If you're unbalanced, if you're having any seizures, if you have any visual problems and you have a headache, that is also a sign that you need to see your GP, especially if you have sudden onset vertigo and dizziness as well. But brain tumours are very uncommon causes of headache, so I wouldn't worry about that when you first have a headache. 10 seconds to go. It's been just wonderful being with you, and I hope to see you again on our next show on the Body, Health and Mind Show. Assalamu alaikum.
Stay tuned